Hi, everyone. Thank you for joining us this evening. My name is Laura Hetzler, and I am an academic advisor in the University Advising Center. And I'm here to present to our Warrior Way Back community on different options to follow health professions pathways for adult learners. So thank you all for having me, and I hope that you get some good information out of this presentation. We're going to tackle this topic from the standpoint of the basic who, what, where, when, why, and how. So from the standpoint of asking some questions about who you are, where you're at with your own career development and career exploration, and then provide some places that you might start doing investigating, gathering more information, and making some decisions. One of the things that I noticed when working with adult learners and having taken some science classes myself as an adult learner is there's a lot of things you have to weigh out in terms of your pros and cons. I think it's natural when we come back to the classroom as older adults to maybe have concerns about re-entering the sciences in particular. That idea that the younger students are faster and they're going to be better at learning, and they're going to have just had this all in high school and it's going to be fresher, and so maybe feeling a little bit out of place, possibly being concerned about being too old to pursue the career or the profession you're interested in. I certainly felt that way. Would have people ask me if I was going to be going into healthcare when I was taking some biology courses and feeling like that I'm too old to do that now. I've got my eyes on a different path. So it's definitely a question I can imagine you might be asking yourself. And then concerns about, coming back and maybe having a less than perfect transcript and trying to pursue a career that has a reputation of being highly competitive. So we'll talk about that a little bit, sort of some of those aspects you might have as a learner. One of the things that I want you to remember about yourself, though, as a student and as an adult learner and what you have to offer, I think you will hopefully find that even tackling the difficult sciences that you are better at prioritizing, you're less distracted by the social life and what's going on around you, and that you have a better ability to value and manage your own time. And I think it's also important to understand that many professional health programs will also value those same things in you. The level of maturity and life experience that you can bring to a future profession are qualities that cannot be taught by a nursing school, by an occupational therapy program. Those are simply the value of your learned experiences that you will bring to this future career. Things you maybe want to consider, and again, I'm going to encourage you to work with academic advisors on this, is your other life responsibilities. So one of the advantages of being 18, 19, 20 is maybe your parents are still paying the bills, but as an older adult, having to balance your life, having to balance school, having to balance your personal relationships as you work on achieving these goals. Know that we're here to help you make some decisions about how you go about that. An academic advisor is also here to help you assess where that balance lies for you. It won't be the same for every student, but we want to help you think through, what do you have going on? How can we help you create an academic plan that will help you meet your professional goals while also maintaining your personal life as well? All right, so what do you want to be when you grow up, right? So a lot of times people might come to this field. One of the things that Amber wanted me to talk about a little bit was, what else is out there besides being a physician or being a nurse? Those are certainly two popular choices for students regardless of age. But there's lots of other options, lots of things that might be a better use of your time and money that will still get you to a fulfilling career where you can hopefully, be paying down student debt, because we know that that's a big issue is managing your time, your money, and your debt load. So let's talk a little bit about some of the other things you might look for in a program beyond med or nursing, and sort of some questions you might consider. If you're still in the exploration phase, this is a great way to sort of start to assess what else you might want to do if, the pathway to physician is maybe longer than what you want or more depth than what you want. This chart's great. It breaks jobs in the healthcare sector out along a couple different axes. The first one is, if you look vertically on there, you'll see it says patient-centered at the top and task-centered at the bottom. So my extroverts out there in the audience, you are probably drawn a little bit more to a patient-centered career where you get to interact directly with people who need your services. My task-centered, you may or may not be an introvert, but you like that to-do list. You like being able to get through your job, do your work, maybe a little more independence within your day, kind of tracking down what it is you need to get done and accomplishing your goals. When we look science extensive versus minimal science, so anyone who works in the healthcare arena may need to take some science courses. And in fact, Wayne State requires all of our graduates to take at least 2 sciences, no matter what your degree is. So you're going to do a little bit of something. But there are certainly ways to enter the healthcare field without taking a lot of sciences. So if you're passionate about being engaged in that arena, you don't want to take 40 plus credits of hard science, we can still find a fit for you. The last piece on this, which is why we call it the ick factor chart, is sort of how much goo do you want in your life, right? So if you are the kind of person who likes to sit at home and watch YouTube videos of surgeries, you go ahead and you find those careers on this chart that are in red. You're going to have lots of there might be blood, bodily fluids, lots of tissues. If maybe you want healthcare, but you don't want quite so much ick in your life, that's where those department or the job codes are listed in a dark color. And then the blue ones are maybe you might handle fluids occasionally, but it's not as intensive as our reds that are listed on this chart. We have this information shared out. Amber has a copy of it, and we also do have copies in the office. Anytime if you're stopping by and you want to grab a copy of this, if you want to grab a screenshot now, go ahead. It's just a way to sort of think about different approaches to exploring. There's one other thing. We also we run exploring healthcare events. Frequently, the Office of Pre-Med and Health Science Centers will encourage exploration in the spring, maybe as you're heading into summer and you want to look for opportunities. And we also promote the National Explore Healthcare's Month, which happens in November every year. So keep an eye out for those opportunities to learn more about different healthcare careers. Okay, so thinking about where can you learn more? So there's a lot of ways you can approach this. Let's say you've zeroed in on a profession and you want to do a deeper dive into what that profession looks like. You may also be at the stage where you've settled on a profession, but you need some help determining what that path to achieve that goal looks like. And then you may also be at the point of wanting to really investigate and tighten up a school list because you've reached the point of application. So we'll talk a little bit more about where to learn deeper information about all of these aspects. So if you're still in the exploring phase, one of the top things we're always going to recommend is job shadowing. I think as an adult, that term job shadow maybe seems a little kid focused. So I would encourage you to think about a couple different ways to approach this. One would be virtual shadowing. Virtual shadowing is awesome because it takes only an hour out of your day. You don't have to go anywhere, but you can get some insight onto what the day-to-day life of someone in that field looks like. The goal for a virtual shadowing experience is to learn for yourself if this might be a good fit for you, to learn what the day-to-day aspects look like. Sometimes I will get students ask, well, does it count? Do I need to write it down? And like I said, I really look at virtual shadowing is that opportunity to affirm for yourself that this career you're envisioning, the career you're exploring is a good fit for you. Career conversations are another great way, particularly for adults, I think, to have some exploration around fields. You can utilize any sort of personal or professional networks you have, reach out, ask people to introduce you to people that they know who might be in that field. Sit down, have a cup of coffee with that person, ask them about what they love, what they don't like, what they would recommend to people entering the field, even potentially having that perspective as an adult. What is my work life going to look like? What's my employment path going to look like? You can ask some more sophisticated questions in that setting than you would be able to in a job shadow, or that you might think of as a 20-year-old. Another option, if you have the flexibility, is trying to volunteer in the field. This can be challenging for adult learners, balancing work, balancing school. But if you can find a way to spend even in, one volunteer shift a month in a healthcare setting, or in a setting where this particular practice goes on, that can be another great way to really develop that understanding. Most of the major hospitals in the Metro Detroit area are taking volunteers currently. And signing up to do that is as easy as going on a website and filling out a volunteer application. What I love about volunteering versus getting a job in the field is it's a very low risk commitment, right? If you go a couple of times and it doesn't work out for you, just sort of no harm, no foul. It's not like quitting your day job, finding a job as a CNA or patient sitter, where maybe you're not going to get the kinds of income or benefit that you need to sustain your commitments until the next level of your education is achieved. There are lots of professional organization websites. So let's say you're investigating something like radiation therapy or radiologic tech. If you Google, professional organization radiation therapist, you'll get to find some different national resources. So I'm always going to encourage you, look for a website that's a .org. We do have a list in the office. Unfortunately, I do not have a digital copy of it, that has a variety of healthcare careers, where to find more information about the national organization. And sometimes you might get just one site. Sometimes we've got national organizations at 2 or 3 different levels. And those can be other great ways to learn about the career you want to pursue. The physician assistant one is one of my favorites, for example, paeaonline.org is awesome, because that website supports prospective students. It supports students who are currently pursuing their education, their master's degree in physician assistant studies, and it also supports graduates. So there's lots of robust information about the pathway into and then the career throughout the lifespan of a physician assistant. So always a good resource if you're exploring. Let's see here. Any other ones? Oh, virtual career and college fairs. Those are still going on. I think that that's one of the great benefits of COVID, is that a lot of those things are available virtually. If you have time to jump on, most of them go for multiple hours. So even if you jump on for 30 minutes, you can ask admissions counselors. You can sometimes speak to current students. Again, great for exploration. And then our career services office, you can do all sorts of different inventories. You can look for job postings and utilize all the resources that they have available to you as a student. All right, so let's assume that you have kind of narrowed down the field of possible pathways to 1 or 2 things, and you're kind of looking for next steps. Your academic advisors are going to be one of your biggest resources in terms of planning that pathway out. In our office, the Pre-Med and Health Science Center, we're located in the undergraduate library. We're still seeing students virtually and in person. We can help you plan out when and where you're going to take courses. We can help you determine appropriate course loads, particularly if you share with us your sort of life commitments outside the classroom. We can make sure you're not getting overburdened academically. One of the things that we really want to encourage students is to plan appropriately so that you're getting the grades you need to get into the programs that you want to do. We're here to help you make sure that that's appropriately balanced. You can also certainly talk to past students. You may know people who've gone through the program. Maybe you've met them working a job or volunteering somewhere. They can be great resources in terms of the experience of going through the program, but you're always going to want to talk to an academic advisor. Our job is to stay updated on prerequisite and curricular changes. So we can make sure that you're following the most accurate list of courses, because that does change year to year. And we have seen in some particular fields drastic changes. For example, programs like occupational therapy going from sort of a 5-year bachelor's to now being a standalone master's program. So we're here to help you understand all of the steps in that, make sure you understand what courses need to be done by application and how that all comes together. All right, in terms of researching specific programs, when you get to that point of knowing what you want to do, now you got to decide where you want to do it. We're going to refer you back to those professional organization websites. Many of the professional organization websites actually oversee the application process. But some other, again, lower level, a little more accessible things you can do to learn about the professions and to make sure that the professions you're investigating are right for you are virtual information sessions or in-person information sessions. Our College of Pharmacy and Health Sciences has run a monthly information session for, well, I've been here 15 years and they've been going on long before I turned up here. So, and that has always been your best way to kind of learn specifically, what does Wayne State want to see from candidates to pharmacy? What does Wayne State expect in terms of occupational therapy, prerequisites, grade minimums, timing? It's really nice because they're run by people within the program. So you can have an opportunity to ask questions directly to administrators. Sometimes they'll have former students who will speak, and you can really affirm for yourself that the program you're interested in will work for you, as well as ask any kind of oddball questions that may be reflective of what your experience has been thus far as a student. College of Education, which is where some of the programs I'm going to touch on is located, also runs information sessions. And then many programs around the country have been running information sessions, both in person and virtually. So doing that so that you understand the process as you head into it is key to being successful at the end. Okay, so one of the things I think that's important to consider as you decide which pathway fits for you is assessing, once you're in the program, what the curriculum will look like. Okay, if you are needing to balance a variety of commitments, you're going to want to stay focused on programs that allow more flexibility once you've started them. Your academic advisor can help you work through prerequisites in a way that works for your life. But many programs, once you get admitted, are sort of lockstep. Medical school is a great example of that. Physician assistant studies is another great example of that. Our nursing program, the accelerated nursing program, is another good example, where once you get in, there is virtually zero ability to work and to have much of a life outside the classroom. So that may be a factor you need to consider as you assess what program works best for you. We'll touch a little bit here on some programs that I'm aware of that are more flexible, if that is an important consideration for you as you decide which way you're going to go. I'm sure there's more out there, certainly on our campus and absolutely beyond our campus, but these are sort of some of the big ones that you might want to consider investigating. Clinical lab science. Clinical lab science is a degree. It's a bachelor's level degree. That can frequently be a good way to go rather than the master's degrees, because it's employable after, a bachelor's degree versus needing the additional certification given time and money. Clinical lab science is the job of analyzing specimens that are collected in a hospital, in a doctor's office. It might be tissues, blood, urine samples. That is absolutely a flexible program that can be done while continuing to work. One of the fantastic things about clinical lab science is because it's so very employable at the end of completing that bachelor's degree, that many people have also used it to launch themselves into preparation for an advanced degree. So what do I mean by that? Clinical lab science wraps up most of the prerequisites for medical school. So let's say you need to finish a bachelor's degree in clinical lab science. You spend a couple of years working, getting some of that volunteer experience that you couldn't do because you were working, a working adult in going to school. Now you can spend a couple years working, doing some of the other things you need to do to prepare for medical school, like taking the MCAT, saving some money, and then you can apply to medical school because you have had this opportunity to get work experience and to get income, along the way. Some of the other ones that are more flexible in terms of the way courses are offered, mortuary science, which may seem like a strange thing. We've got one of the very few, I'm not going to remember the number. For a long time, we were the only bachelor's degree in mortuary science in the state. I think there's one more now, but they have a fully online option. And again, it's a field where we're seeing increasing numbers of retirements. And the mortuary science field goes through that process of both helping families adapt to the grief and grieving of the death process, but also making sure that bodies are treated respectfully, preserved appropriately to prevent disease. And then you also are going to be running a business. So it's a very, very multidimensional career. May seem like it's a little bit out of left field, but I think it's a really, really interesting option for many students. And they have a couple different options, one of which is completely online. So that's another nice aspect of that particular career. It terminates in a bachelor's degree. So again, after completing that bachelor's degree, it's very, very employable. There's a couple options in the education school that are also very flexible. They're a little less, if you don't want quite all the science and ick that goes into mortuary science and clinical lab, can be nice options. Community health is a field that is focused on, it can lead to careers in public and private agencies, maybe with local health departments, volunteer organizations, hospitals, health insurance companies, corporate health and wellness programs. So there's a variety of types of work environments, locations, kinds of things you might do in community health. All right, so the goal of community health is to advance health equity. I'm reading this because I don't have it memorized, but I think it's a really, really interesting option. Advance health equity through the preparation of community health education specialists who explore the multiple levels of health, including individual, family, community, policy, and systems, and social determinants that influence behavior and health. So if you think about where we've been in the last 2 years with COVID, right? You can see how having community health education around health behaviors, around vaccination policies, around, around the policies that a workplace might determine in terms of vaccination, return to work, all these kinds of things. So it's focused on maintaining the health of a community, but without all of the like anatomy and phys, micro, orgochem, if that's not where you want to be, but you want to work with people on improving outcomes, community health could be a good spot. Our College of Education offers both a bachelor's of science and a master's degree. The master's degree is focused on, that career advancement, and it can be done completely online, which again is a really, really nice option for an adult learner, I think. So, all right. The next college I'm going to touch on that has some nice flexible options for entering sort of health career and health services is social work. So social workers do have, I think the piece that is the most obvious is many people who provide mental health counseling are MSWs, Masters of Social Work, so that they've gotten a degree, they can get licensed and provide mental health treatment for individuals. And that is absolutely a place where we see a need for MSWs. But they also can work to advocate for policy change, reduce healthcare disparities, improve access to healthcare, particularly around the needs of more vulnerable populations. So you might find healthcare workers in acute care or clinical settings, like in a hospital. You might also find them doing rehabilitation, working on public health issues, working in substance abuse. All of these are places where you could intersect with healthcare, have a social work degree, and again, not have to do some of those deeper, more intensive life sciences. Both the bachelor's degree and the master's degree can be done completely online at Wayne State. And then the master's degree offers further opportunities to specialize in areas like gerontology, so the care of the elderly and aging and the concerns around that population, infant mental health, developmental disabilities, substance abuse studies, again, all opportunities to really do a deeper dive and support some vulnerable populations, also in a way that can work for you as an adult learner. Okay. So the programs I just touched on tend to be a little more, like I said, they're a little more flexible. They're a little more forgiving, if that's the right word. And they're certainly always recruiting and looking to fill class sizes. Some programs that our returning adult learners are interested in absolutely have a more competitive aspect to the application process. So in those cases, your original grades are going to be assessed a little more heavily, potentially as a, potentially in a detrimental way, but certainly not to the extent that that means you cannot pursue your goals. All right. So the grades are going to matter more in certain programs like nursing, like medical school, dental school, like physician assistant programs. However, there are two things to know about this. One is many of those more competitive health science programs do have ways for students to compensate for a weaker start. It does take more time and money, which is not something adult learners are always willing to do, when they have that sort of realistic thought. But there are also some of these more competitive programs that will look at the last 60 credits of academic work that you've done. Okay, so these are the kinds of things that, again, you might look at as you start investigating programs. Here at Wayne, for example, if you are interested in applying to the master's degree of occupational therapy, they will do a last 60 credit hour grade point average calculation if your original undergrad GPA is lower than a 3.0. So absolutely keeps the door open for you if you've had sort of a rocky start if you started right out of high school. Our physician assistant program, and actually many physician assistant programs, will also do a last 60 credit count if your overall GPA is lower than a 3.4. So again, maybe at 18, 19, taking some basic sciences, you didn't do so well, but now mid 30s, you're hitting 4.0s. That can be a way to look at it. The reason PA programs have done that historically is because physician assistant programs came from members of the military returning from frontline service. And then sort of the medical field wanted to look at a way to harness all of the knowledge and experience that these people had, but they maybe didn't have the educational background to accompany the level of life skill that they now had as a result of this time spent in the military. And so historically what we've seen is older, more mature candidates for PA programs. And so then programs are a little more willing to kind of overlook maybe some early mistakes on a transcript in favor of this more seasoned adult that they could recruit into the healthcare field. One more program to think about at Wayne, if this is maybe the case you're in, is right now the pharmacy program will also do a last 60 credit hour waiver. They've also waived the PCAT for students who have an application GPA at a 3.0 or above. So it can be a great way to get into a very steady career associated in the health sciences, good employment outlook, without having to jump through quite as many hoops as you maybe would for medical school. Okay. All right. So how to build your success pursuing healthcare pathways as an adult learner. It's usually a combination of time, money, and resources, like so many things in life. All right. So one thing I hear from my adult learners all the time from returning students is, I want to be there now, right? I finally figured out what I want to do. I'm ready to be there. So let me crank through these prerequisites. And I hear you. I hear the urgency, the desire to reach your goal now that you've figured out what it is. However, one of the biggest mistakes we see students make is rushing. I would much rather see you start slowly, get the grades you want, make sure your tuition, you're getting the value out of your tuition dollar. Make sure you can handle it around your other commitments. All right. Then if you try to take 3 classes at once in a shortened semester while working full time, and now because you overburdened yourself, you didn't do well enough in a class, or maybe you had to withdraw, and you are getting classes completed, but you're not completing them well. All right. So if you're on a pre-health pathway, make sure that you're working with us to get you a strong, realistic plan for progress. All right. Share your life commitments with your academic advisor so we can make sure that we're not putting you in an overly burdensome course plan when you've got a lot of work commitments or a lot of family issues going on. All right. And then as you go and you sort of make sure that you are rebuilding those student skills, you'll figure out what you can handle. We can certainly add on to it. But we don't want you to start too intensely and then not be able to achieve your goals. The other thing you want to start to look ahead at is, as if you are picking a science heavy curriculum, you need to assess kind of your work balance with school the further you go in those sciences. Many of our lab sciences are only offered between 9 and 5. You might find at the basic level, the intro level, that you get some 4 and 5 p.m. lectures, but many times those general chemistry courses, Gen Chem 2 or Go 2, there'll be one lecture section. It'll be during the day, and you'll need to add discussion in lab as well. Your academic advisors are absolutely here to help you figure out if there are other ways to get those requirements met, other schools you might want to investigate. But again, make sure you're planning that with an academic advisor. We have a good understanding of which programs will accept, say, a large number of community college credits versus not. And some of those other things you want to consider beyond just what time of day is the class offered. That's a key piece. All right, thinking about the money part of it. Definitely understanding financial aid and the amount of money that you are taking on, and you've gotten that all, that you are getting your financial aid, your FAFSA filled out early in the process, and that you're taking care of that information, that you're applying early. Checking out if there's scholarships available for adult learners. And I'm sure that these are some resources that Amber tries to connect students with, but it's always worth a mention. And then finally, talking to a pre-health advisor about, are there classes you could be taking at community college? We know that's an important way to help students save time and money, and or, like I said, maybe you can find a class that will work at a better time of day for you. We're really here to help you to achieve those goals and get through this on your time and financial budget. Community college can be a great way to do that. All right, thinking about using what your resources are for this process. All right, we want you to make sure that you are utilizing the service. One of the beautiful things about being an adult learner is that the resources are out there, right? And hopefully you're smart enough and wise enough and experienced enough to utilize all of the things at the appropriate time. So here's just a few to think about. That peer mentor for the extra help on the subject that's a little tough. Academic Success Center, I can't say enough good things about it, particularly when it comes to supporting our students in the sciences. Use your office hours. Again, adult learners tend to be a little more savvy about this and understand that creating a personal relationship may be something that you really need to spend time on if you're then going to go back to an individual and have to ask them for a letter of recommendation, let's say, to get into your program later. So office hours are the best way to do that. And then student disability services. If it's a short-term thing, if it's a long-term thing, maybe you get a new diagnosis for something you weren't aware of, but now you've discovered as an adult learner, great resource for helping you build your success and be able to pursue your goals. Many of our health science students tend to be perfectionists. They tend to be hard on themselves. They tend to be make it work people. So I'm just my little plug for using resources like CAPS if you want formal one-on-one counseling. Let's Talk is a more informal option available through CAPS where you can just have time to decompress with somebody. And then different student communities. I know that the adult learners now have a student organization as well as different Wayne State student organizations that may be more focused on your professional goals or your personal interests. Finally, always keep an eye on Academica. You never know what's going to post up on there, whether it be a resource that you could use or an opportunity to get engaged in research or to join some sort of event that could really launch or help you stay focused on your goals and your career. All right, so I've flown through that, but I think I want your biggest takeaway to be that there is more than one way to go about achieving your goals for pursuing a health career. There's more than one field of entry. There's tons of resources, and we are here to support your goals. And we understand as an adult learner, you have a variety of challenges, but as you communicate with us, we are here to help you make a plan to make it all work, regardless of where you want that path to end. So.
Thank you, Laura.
You're welcome.
Let's see.